Welcome to Straight Talking. Thank you so much for joining us. And on tonight's show, breastfeeding. In the northeast, figures are still low. We're going to be finding out why, what we can do about it. And I have some esteemed guests with me. Amanda, your title is incredible. Never going to be able to do this without looking at my paper. International Board Certified Lactation Consultant.
Yeah.
That means you know an awful lot about breastfeeding.
Well, I try to, yes.
Well, thank you very much for being with us today, Amanda. And we've got Lisa as well, Lisa Lane. And Lisa, you're a breastfeeding mum at the minute?
Yes, yep.
And you make amazing fudge?
Apparently, yes.
That's what's going on.
Not with breast milk, though.
No, that would be kind of weird, but I don't know, I'd probably try it. So I'm quite disappointed that we haven't got any babies. In fact, I'm very disappointed we haven't got any babies. But we do have this baby.
Needs a wash.
Does need a wash, been drawn upon by a child, I think. And also in the studio today, this is an absolute first, and I'm guessing it's a world exclusive. We have a knitted nipple. You see, you get everything here on Straight Talking, a knitted nipple, which is great. What do you use this for, Amanda?
We use it teaching mums how to hand express, to get some colostrum off, to actually, when the milk comes in, the baby won't latch on.
Yeah.
It's much easier than a piece of plastic to
quite comforting to squeeze as well. So that's that, and the baby. Now I'm going to just put the baby down there for a second. So, why are our figures, Amanda, in the northeast so low? Why?
I think it's a lot to do with society. We're probably getting onto 4 generations now of women that have not breastfed. So your mum didn't do it, your grandma didn't do it, possibly even your nana didn't do it. So we're not seeing it out and about.
Why do you think they didn't do it? Why? Those 4 generations ago, was breastfeeding, you know, when it is considered the most natural thing to do and the best thing to do for your baby, why would it not have been, you know, the thing to do?
I think that it was practices within maternity units in the 50s, in the late 50s, early 60s and 70s, where mums and babies were not kept together. After delivery, babies were taken into the nursery and they were bottle fed during the night so mum could rest. And this impacted probably quite significantly on how much milk a woman would actually have. Also there were practices that sort of you had to feed your baby 4 hourly. Well, babies want to feed a little bit more than that. And you were taking advice from the experts, and then your milk you probably did not have enough.
Because you do hear that cry a lot, don't you? Oh, I haven't got enough milk. Mm-hmm. But do you think that was just really a physiological thing? Because they were only feeding every 4 hours, the milk wasn't coming in?
I think it had a lot to do with the impact at birth, yeah. And having the babies taken away overnight, whereas common practice now is to keep mums and babies in. It's termed rooming in. We keep mums and babies together as much as physically possible in those early hours, so that mums can pick up on the feeding cues, mums can have skin-to-skin contact, and babies can have access to the breast and feed as much as they want to.
In terms of attitudes, Lisa, and attitudes and prejudice that you face, because you know it's often that we hear stories about breastfeeding mums that are looked upon that they're doing something disgusting. Have you faced difficulties in the northeast?
Yeah, but it's like water off a duck's back to me. My baby's needs come first. So, be it when my son was a baby, we were in the Metro Centre, and me and my mum were having a cup of coffee and or tea for me, not coffee, and some cake. She was like, "Is he not finished yet?" She got up to leave, and the man 2 tables back, when my mum got up to leave, saw that I was feeding, slammed his knife and fork down and went, "Oh!" and then walked off.
So, well, was your baby not allowed to have his tea? He was
Clearly
having his tea.
Clearly not. But I'm very much I'm not a nervous feeder. I'm just when the baby needs feeding, the baby needs feeding.
But in terms of attitudes generally, do you think that there is? I'm not necessarily going to say it's men, because I think some women are
worse. I think women are definitely worse. Yeah.
You know, in terms of, I remember being in a Pizza Hut once, and I wanted to feed at the table, and I was sent to the loo, and I had to sit on a loo and feed my baby. I mean, that's a long time ago. Do you think attitudes have changed at all since then? That was 17 years ago.
Yes, because there's a lot more media awareness now of the Equality Act, and that you're not permitted to ask a mother to leave an area. But it does still happen through ignorance more than anything.
You know, breasts are, you know, let's just talk about it. Breast, boobs, obviously there's something sexual about a breast.
Yep.
There is. But do you think there's a certain sense that people think, oh, well, they're a sexual thing. They're not for the baby. Do you hear that, Amanda? Do you see that?
Yeah, we do. It's quite often if you talk to a mum antenatally, and she go, not having a baby suck on my tits is what they say. They're not for the baby. They're for my partner. And I'm thinking, thought they were yours actually.
Yeah. So should we encourage women to feel that, you know, it's part of our bodies, therefore you do with them what you want to do with them?
Yeah, definitely.
And in terms of looking at the benefits of breastfeeding, you know, purely going through what is the best for your baby, what would you say to somebody that are watching? What are the things that your baby gains from breastfeeding?
I mean, you can really talk about the reduced risk of ear infections, throat infections, bronchiolitis, chest infections, the gastroenteritis. There is a significant reduction of risk to your baby by breastfeeding. It doesn't, however, mean that your baby's not going to get poorly. And I quite often get people coming and saying, I was told that baby wouldn't get asthma because they're breastfed. Babies get asthma. Babies get poorly. Just because you're breastfeeding doesn't mean they're going to not get them. It just means they're going to recover quicker, be less poorly than they would be if they weren't breastfed, because the whole time you are feeding, you're producing antibodies, and you are producing antibodies that go into your baby. They actually then help your baby's immune system and help program your baby's immune system as to which antibodies to make and fight it off themselves.
Did you consider that, Lisa, when you thought, I know you've got 2 children, haven't you? Did you think, oh, well, it's the best thing for them, that's what I'm going to do? Or was it just absolutely natural instinct? There was just no question you were going to do anything else?
There was no question, really.
Mm-hmm.
And I didn't, when we were trying for a baby, I already knew I would be a breastfeeder and had known for years, even before I met my husband, that I would be a breastfeeder. And I think it's something, for a lot of people, it's in you and what you inherently believe in. And then there's some people who can be persuaded, and but definitely, I mean, Amanda mentioned the illness bronchiolitis. Evan unfortunately had that when he was 8 months old, and he went downhill quickly, but he also recovered really quickly, and a lot of that was to do with the breast milk. He's been exposed to chicken pox so many times, and even though he hasn't breastfed now for nearly 2 years, he still hasn't got chicken pox.
So
It's not a coincidence.
Nah. So there are clear positives. Also, there's that whole thing where you do lose weight a bit quicker. I don't know if I did. I don't think I did.
It depends.
Everyone, well, yes, clearly not. Everyone mentions the benefit to the baby, but Amanda will know the exact figure of calories. It burns extra calories.
Yeah, but you put more in.
Yes.
I mean,
So you could eat cake.
you use about 600 calories a day. It doesn't necessarily mean you need an extra 600 calories a day.
Yeah.
I think for mums, the benefits are, especially if you've got a nana that's breaks her hips and got osteoporosis, the longer you breastfeed for, the different times with different children, so we can add your 2 children together, it actually reduces your risk of getting osteoporosis, of premenopausal breast cancer, of ovarian cancer.
There's so many benefits.
So many benefits to a mum to actually breastfeed that we don't talk about those ones.
And in terms of a dad, from my husband's point of view,
You can sleep through it.
he slept through.
Yes.
Never did a feed.
No.
So that is quite a good one. And in terms of cost as well, I suppose.
I'm sure my husband will not mind me saying he loved breastfeeding because A, it was free, big one. B, it was good for the baby. C, he didn't have to do it. And D, he got to see my boobs a bit. Wasn't allowed to touch them.
I'm sorry. No, that's fine. You can say that. We're
But
very informal.
it was free. End of story.
Yeah. And in terms of the bond between you and the baby, to anybody that's watching the show now, what would you say, Lisa? What is that bond that it gives you?
Well, it's just your special time with your baby. It's the time. It's when it's just you and them, and no one's interfering. I was in IKEA the other day, and Connie was having a feed, and she looks up longingly, and she's having a bit giggle to me. And a couple of tables over, there was a dad giving a baby a bottle, and the baby looked about the same age as Connie, and the baby was just not engaged at all with its parent. It was facing away, so there was no eye contact at all between in that case, the dad and the baby, and I think it's quite sad, really.
So in terms of the physical connection,
yeah,
it's there.
Because like Connie and I, and you can have a little conversation just with your eyes with them.
But let's not pretend that they never bite, because sometimes they do.
They do bite, yes.
We are discussing breastfeeding on Straight Talking. After the break, is there too much pressure on people? And do mums sometimes suffer because they're not breastfeeding? We're also going to discuss what can be done to encourage more mums to breastfeed and what help and support there is out there. Thank you very much for watching Straight Talking.